Cosmetic surgery appears to be popular with the teen set. In fact, in 2010, more than 3,000 people between the ages of 13 and 19 had liposuction. But with the FDA's approval of non-invasive treatments, minimally invasive procedures may be a better option for young adults. CW33's Barry Carpenter shows us how more young Americans are choosing change.
Patients are getting younger, but the under 20 crowd still represents the smallest percentage of people actually having cosmetic procedures. But that may be changing. Liposuction is the third most requested procedure, and for those squeamish about surgery, they now have options.
Also does some skin tightening.
19-year-old Braelyn has wanted to do something about her stomach and outer thighs since she was 17.
Probably senior year. I was still really fit, but I've always had like the one area and the one body type. So probably since then, since high school.
Now the SMU sophomore has decided to take the plunge with a non-invasive procedure the Food and Drug Administration approved in December. It's called Liposonix and uses advanced concentrations of ultrasound to destroy fat cells under the skin. She says many students her age are having cosmetic procedures.
I know a lot of people have had breast augmentations, nose job, especially in the area that I'm in. So I think a bigger percentage than normal.
You may bruise a little bit.
Dr. Bill Johnson is the medical director of Innovations Medical in Dallas. He says about 10% of his patients are 18 and 19 years old, many of them drawn to minimally invasive technologies.
I think there started to be more interest in that, and I think it's easier to say yes as a clinician to that. You know that there's minimal risk, and you know that it's a good place to have a good first experience with this kind of work.
Dr. Johnson says most women have achieved their normal body shape by 17 or 18. Under that age, it's not recommended. Braelyn's trouble spots are marked. And the ultrasound is applied. Dr. Johnson says the only real side effect is minor bruising. Braelyn says it feels like a bee sting.
It kind of feels like needles are pricking me every once in a while.
Dr. Johnson says the targeted fat cells are gone for good.
The fat cells themselves are destroyed, so the fat can't come back because the cells they were living on are gone. They have been destroyed and then dissolved by the body.
Braelyn says her parents are supportive of her decision, which will cost upwards of $4,000. She says surgery simply wasn't an option.
This is a lot less frightening.
Barry Carpenter, CW33 News.